Microbiologist Yuen Kwok-yung has suggested that the chlorine level in reservoirs be increased to kill the bacteria that causes melioidosis, a potentially deadly disease. The number of cases in Hong Kong this year has jumped to 34, with at least 7 deaths related to the disease. Janice Low reports.
Hong Kong University microbiologist Yuen Kwok-yung inspected 2 reservoirs near Sham Shui Po district this morning. He said the residual chlorine level in both reservoirs meet World Health Organization requirements to kill the bacteria that causes melioidosis.
隨住時間咧，佢嗰個含量咧個氯含量會降低嘅。
But as the residual chlorine level decreases when the water reaches homes, Yuen suggested that it be raised from 1 part per million to 1.2 parts per million. As an added precaution, he proposed installing ultraviolet light at the reservoirs to ensure that the bacteria will be wiped out. Hong Kong has had an average of 10 melioidosis infections in recent years, but the number jumped this year. So far, 34 cases have been recorded, 23 of them in Sham Shui Po. There were 7 melioidosis-linked deaths. Soil taken from a construction site in the district was found with melioidosis DNA. The disease is caused by a bacterium that is common in soil and muddy water. Yuen, along with Albert L. from the Center for Health Protection, visited HKIBC Service Reservoir, where they took samples from a manhole and its cover, as well as the surrounding soil. They then inspected the Butterfly Valley Freshwater Primary Service Reservoir. Although melioidosis has a high mortality rate, Yuen assured the public that it will not spread from human to human. He urged people to leave the tap running for 1 minute in the morning before using the water and to boil food. Janice Low, HKIBC.